Hi, my name is Regina Adjikun, and my presentation is going to be about Adderall and its effects on people with ADHD. So, a little background about the drug that is under a class of drugs named amphetamine. When it was first synthesized in 1910 by Barger and Dale, they didn't really know what it was. A few years later, G.A. Alice synthesized it for a substitute of endephrine, which is known as a hypertension drug. When doing experiments on the drug, they saw that it has similar effects to methamphetamine, which induces effects of arousal. When doing more tests, scientists saw that it had an effect on children with behavioral problems, so known as ADHD. Behavioral effects. Because ADHD is a known disorder, a lot of the symptoms are known by the public. Some of the effects that Adderall induces in people with ADHD are mood enhancement, increase in concentration and attention, and increased physical activity or energy. Some articles that I read suggested that Adderall also improves long-term memories as well. So looking at the pharmacokinetic effects of Adderall, it is most likely taken orally. When it is taken, most of the drug is absorbed, but evidence has shown that it is metabolized by CYPD6. And because there are two different types of drugs, which are IR, so known as the immediate release, and XR, known as the extended release, they sometimes have different metabolic and elimination effects. XR is the most common, where people take dosages between 5 to 6 milligrams daily. Factors such as pH imbalances also have an effect on bioavailability as well. So it has been shown that if your stomach is less acidic, you have more bioavailability to absorb the drug. What does it mean to have ADHD? ADHD, also known as attention deficit hyperactivity disorder, is a neurodevelopmental disease mostly found in children. Usually when people have ADHD, they lack in focus and concentration due to their low levels of dopamine release. Adderall acts as a stimulant to increase dopamine activity so people with the diagnosis can have increased focus and concentration. So what does Adderall do? Because people with ADHD have low levels of dopamine, Adderall binds to monoamine transporters that release dopamine to increase release out of the synaptic cleft. Adderall acts as an antagonist against VMA2, which are basically vesicles in the presynaptic neuron that prevent dopamine release. As an antagonist, Adderall will increase postsynaptic monoamines. Some studies have shown that Adderall does help to inhibit MAOAs as well. Adderall and abuse. The FDA recognizes Adderall as a Schedule II drug, meaning that it has a high addiction abuse potential. One of the interesting things about this drug is that it has a specific type of reinforcement called the amphetamine sensitization. This is basically where repeated use of the drug causes an increase in sensitivity and makes reinforcement a little different than others. This shows that pharmacodynamic factors play a role in maintaining addiction and tolerance. Studies have shown that people who take amphetamine type drugs, such as Adderall, have a reduced number of monoamine transporters over time. This indicates that less dopamine is being released, so more Adderall will have to be used to take the same effect. Although some studies need to be looked at for withdrawal symptoms, because a lot of them don't have them. These changes in the monoamine transporters suggest that it can impair concentration when they're off the medication. And some studies show that people who take it orally have lower abuse potential as well. And these are my references.